Welcome. My name is Sylvia Roozen. I'm the Secretary General of the International Federation for Spina Bifida and Hydrocephalus, and I welcome each one of you during today's event, which is the first online World Spina Bifida and Hydrocephalus Day. I also give a warm welcome to our speakers of today, who are in fact our members from SBH associations worldwide. We are grateful to host this webinar also in collaboration with Dr. Santosh Karmarkar from the SBF Foundation India, which is special thanks also to our sponsor, Maya Vitabiotics. And please note this meeting is a live webinar event and it will be broadcasted also on YouTube with the possibility for translations. And the YouTube link will be shared with you in the chat box. The World Spina Bifida and Hydrocephalus Day is a very special highlight on our international agenda, and this gives us the opportunity to share our stories with our stakeholders on an international scale. It also enables us to celebrate the achievements, to connect with you in person, and to thank you for your part in promoting and protecting the human rights of people with spina bifida and hydrocephalus. The World Spina Bifida and Hydrocephalus Day is each year an important event where communities around the world raise awareness for individuals with SBH. And this year, due to COVID-19, we have to do it a bit differently. So we are extremely grateful you have found your way to be present during today's webinar. We also have our social media team ready, who is connecting with you throughout the webinar on the IF platforms. And I can tell you we already received several testimonial stories from people such as from Belen Hernandez from Guatemala, who says, I dream of a world where disability is normalized and not seen as something strange. Of course, we can all make a difference wherever we are at this stage in this world, but it's about making a change happen together. And therefore, for this important event, we invited speakers from member associations from different chapters of the world to share their words on the World Spina Bifida and Hydrocephalus Day. During this webinar, we furthermore share 3 testimonial stories with you. And last but not least, we welcome you to participate during the Q&A sections of today's meeting. May I present to you the speakers of today's event. We have Dr. Santosh Karmarkar from the SBF Foundation in India. We have Elena Zappoli, who is our IF president, but also the president of the Argentina Association. We have engineer Dr. Kribanandan from the Malaysia Association, Hans Christian Norseth from the Norway Association, Sara Struwe from the America Association, Ruth from Uganda Association, and Anna Polevskaya from the Russian Association. And the speakers will all share a 5-minute presentation with you on behalf of their association, reflecting on the topic of spina bifida and hydrocephalus and the change they make happen in their countries and their continents for the communities they represent. We trust the presentations for today also serve as inspiration for all the hard work you are currently doing on behalf of your communities worldwide. We furthermore have 3 special guests from 3 different continents sharing their testimonial stories. So I want to thank you, Victoria, Olufunke, and Sir Raipal for your willingness to be here today and share your important stories with us. We also invite you as audience to actively participate during today's event. You can leave your questions and comments in the Q&A box below, which you can see on your screen. I will be your moderator for today, and together with Dr. Santosh Karmarkar, we will lead the panel discussion and take your questions later on. But first, without further ado, it's my pleasure to introduce to you Dr. Santosh Karmarkar, who has an outstanding track record in the field of spina bifida as senior consultant pediatric surgeon and has an interest in effective prevention measures as well. Dr. Karmarkar is a former board member of our international federation, and it was throughout our collaboration that we actually hosted the international conference in 2018, but now also together the first online World Spina Bifida and Hydrocephalus Day webinar. Dr. Karmarkar is also a public health activist and editor-in-chief, and today we will learn more on a global perspective on SBH. And after the presentations, together with Dr. Karmarkar, we will lead a panel discussion with all speakers. But for now, Dr. Santosh Karmarkar, we look forward to learning from you, and the floor is yours.
Thank you so much, Sylvia, for those kind words of introduction. And it is really a great pleasure to do this joint live webinar with the International Federation on this very, very special occasion. Okay, so I'll just wait for a second for the slide to come up. Can you see the slides?
Yes.
Yes, the slides show up. Yeah.
Is it in slide mode? Is it in?
Not yet.
Okay.
Not yet. Now it is.
It's come up. Yes. So firstly, again, a very, very warm welcome to all participants from across the globe. So I know you are in, it's good morning for some, good afternoon for some others, good evening for some more, and I hope it's not good night yet for the others at the other end of the world. The theme of this World Spina Bifida Day is United in the Times of COVID-19. And it's indeed a very, very relevant and very important theme, because as I see it, COVID-19 has really united all of us in a very strange way. It has underlined the importance that we all, wherever we are, we need to look at so many things at a global level and at the level of a global community. And that is what I think this pandemic has underlined. And I think I sincerely believe that the time has come for all of us to look beyond nations, beyond nationalities, and look at various things at a global level. And if you are fans of Yuval Noah Harari, a great modern thinker, then you will realize that the more important, the more pressing problems of today are indeed global in nature. So whether it's a pandemic, whether it's terrorism, whether it's climate change, whether it's nuclear war, the time has come for the world to look at itself probably, start looking at itself. It won't happen overnight as a planet nation. So the theme for this year, United in the Times of COVID, is so very appropriate. And last but not the least, COVID-19 has also taught us how to use Zoom and unite the world on this global technological platform. And I sometimes wonder why we were not doing this earlier. So certainly we are more united in the times of COVID. I also take this opportunity to welcome you all formally on behalf of the Spina Bifida Foundation of India, which we began in 2006, but it got formal registration and recognition in 2009. And since then, with the help of so many people, doctors, families, parents, social workers from all across the country, we have made tremendous strides. And I'm happy to mention that we now have formal chapters in about 15 states of India. So we've covered quite a bit of the country now. And we also now have more resources and more support for the activities that we do. And again, a big thank you for the Mayor Vita Biotics organization, which has stood solidly behind some of the important activities that the foundation has been doing in the last 4 to 5 years. We started a helpline this year, and every week, many families, many newborns, many patients, and individuals with spina bifida have been contacting us through the helpline, seeking support for treatment, for rehabilitation, and so on and so forth. So these are actual pictures that you see of the children and families who reached out to the foundation in the last couple of months. For more details, you could probably visit our website. The address is given below. The foundation has been conducting outreach programs. We go out to different parts of India, do free checkups, free counseling for spina bifida, and we do hold events on major days such as the World Birth Defects Day. And it is probably needless to say that the Spina Bifida Foundation of India is very close and has good international ties with all of you. And maybe some of you have already met us in the past. But this is a good picture of the 2018 conference that we held in New Delhi. And maybe some of you who are participating today can locate yourself in this picture. Okay, with that introduction about the foundation, let me come to the topic of my presentation, and that is a global perspective. So today I'm not going to spend the next 5-10 minutes talking about the technicalities of neural tube defects, its medical treatment. We will briefly talk about it, but I want to share with you some of the issues that exist at a global level and for which maybe the International Federation and our associations need to collaborate and work. We spoke about the world being united in these times, but unfortunately, friends, we still are many, many worlds. It's still not a uniform and equal world today. The World Bank divides the world into the high-income group countries, the middle-income group, and the low-income group. And as you can imagine, many things such as awareness, prevention, diagnosis, primary, secondary care, rehabilitation is much, much advanced and far better in the high income group countries, which are seen in the blue color in this picture. And expectedly, all the aspects are not so very up to the mark in the lower income group countries. But there are some aberrations. If you see tertiary care and expertise I can tell you by first-hand experience, after visiting centers in all the blue part of this world, then many of them lack advanced medical expertise, such as incontinence operations, uh, fancy detethering operations, and not because they don't have the skills and the expertise, but because the number of cases that an average surgeon gets to do is far, far less. And some of these operations require maybe 10, 15 years of experience to do them well. So there are some aberrations. It's not that everything is up to the mark in the high income group countries. And it's not that everything is bad in the lower or middle income group. For example, tertiary care, the expertise is probably much more in some middle group. So we are still many worlds. When we talk of how many neural tube defects are there worldwide, we need to know that to make a good estimate, an accurate estimate, we need to have good national registries. And if you see this, again, world map, you will realize that it's only in these blue shaded, blue colored countries that national registries, which are accurate, exist. But in most other parts of the world, there is no proper estimate of the number of children born with spina bifida. So the International Federation needs to look into promoting and lobbying with the individual country associations and in turn their governments to set up a proper birth defect registries. If we look at the prevalence rate per se, and this is again from data which is collected from published literature, it is some of these countries don't have national registries. So you see here in, for example, India, there are these red color dots. So these are some areas from which data is available. And you see that most part of the Indian subcontinent, the incidence is above 22 per 10,000 births. And this is greater than 22. And in some places I know there is an estimate of the incidence being more than 80 per 10,000 births. So there's a vast range of prevalence in Indian subcontinent. Go more east to Far East Asia. China, as can be expected, has very good national registry. So you see the orange color covering the entire country. And but there are pockets in China with a unduly high incidence. Let's go to Malaysia and Singapore, and they have good national registries as per this map, and their incidence is low, is in the green. So whichever countries are green, the prevalence is probably as low as it could be. So the green is the good countries with low prevalence. Now, let's look at Europe, and you realize that a large part of Europe is not green. And when I was looking into these figures, I said I was a bit surprised because I thought the incidence will be ideally low, but it's not. And a major part of Europe is still orange and yellow, which means the incidence is a little higher than what it really should be. The eastern end of Europe, Turkey, the incidence is very high. If you go to the Americas, again, as expected, in the North America, good national registry, and low prevalence, low incidence. Not so in Latin America. There are not enough good national registries all over, but in some parts there is a national registry. I believe, as per this map, Argentina counts the children born with the anomaly well, and but still the incidence prevalence is pretty high. So we need to look at registries. We need to work towards counting figures very well. Look at the Middle East, again, essentially red, that means high incidence. Look at Africa, again, red dots, that means very high incidence, above 22 per 10,000. So it could be 40, it could be 15, it could be much more than 22. So prevalence and study of the figures is something we need to do. If we translate these prevalence into actual figures, and I have data about that for India, I think neural tube defects in India is a problem of epidemic proportions, because when we did some calculations, we realized that assuming a realistic figure of 4 per 1,000, we are looking at more than 25,000, 40,000 children born with neural tube defects in India each year. And if you see, combine the ones which are born in the previous years, you can make an estimate of the burden of neural tube defects. So we need to look at prevention and birth defects registries. Now, here is an interesting map of countries where prevention efforts are being done well. That means fortification is prevalent, is being done. So in the green parts of the world, where you see the green color, prevention by way of fortification of flour is in place. And therefore, some of these countries, the prevalence is also low. But look at this map, essentially maybe more than half, about 2/3 of the world still lacks adequate efforts for prevention. And by prevention, we are here trying to emphasize on fortification. Wheat flour, maize flour is not consumed universally in a branded way, and therefore there are some difficulties. So in this next line, there is a suggestion now that if one fortifies salt with folic acid, you can practically cover the whole world and get enough folic acid into the blood of mothers to be and into the whole population. So there are some initial thoughts now, and this is data and slide borrowed from the Center of Spina Bifida Prevention in Atlanta, where our friends Dr. Godfrey Oakley and Vijaya are doing wonderful work in trying to implement salt fortification. And I believe they have some project going on in Ethiopia towards salt fortification. So fortification is another area of interest where the International Federation, along with all the other associations, must take some lead and try and push things a bit ahead. Let's come to, after prevention, come to the status of diagnosis. Unfortunately, in many parts of the world, antenatal diagnosis is also significantly lacking. And we need to educate ultrasonologists to do a good anomaly scan. What if you diagnose a neural tube defect in utero? What happens? Today, if you are in Europe, And if you are in USA and probably in Singapore or Japan, the family will be offered fetal surgery as a viable clinical option. And fetal surgery is now medically known to be a superior option than operating on these children after birth. And therefore, promotion of fetal surgery is also something that the International Federation should do. We are trying to set it up in India, and I was in Katowice in Poland last December, and to learn fetal surgery from from the pediatric surgeons in that center. So I'm sure over the next 5-6 years, many centers across the globe will embark on fetal surgery programs, and which is a good thing, and which the International Federation must definitely promote and support. As regards care after birth, it is again sad that in many parts of Southeast Asia, Africa, primary and secondary care is also not available promptly and properly. So that also is an important issue, and we don't have time to deal with all of them, these issues in detail, but I'm just going to give you a quick overview of how things stand. So primary, secondary care, and seeing that children get if good prompt primary care is important in many parts of our world. I am now going to spend a minute discussing this important, I would say, development or issue right next to our headquarters of the Federation in Belgium, and indeed in Belgium itself, but in Belgium and Netherlands, they in 2004, physicians, surprisingly doctors, came up with this Groningen protocol, which in fact allows legal active euthanasia. When they did a review study after this, after active euthanasia was allowed, in 2005, they found that all the 22 cases were cases of spina bifida and hydrocephalus. When there has been criticism about this protocol, and there have been reports saying that this is nothing but pushing infanticide. And I think as a foundation, as a federation, we must make be critical about such protocols being promoted, because I personally definitely feel that this is not the way to go, because this is eugenics. You will start then, and in fact now the Netherlands just 2 weeks back has allowed this protocol to be extended to children beyond 1 year. Earlier, it was only in the first year of life. Now it's extended to children between the ages of 1 and 12 as well. So I think this is a very, very dangerous trend. And active euthanasia, certainly for spina bifida, is something that should not be protocolized and that should not be legalized. Passive euthanasia, again, friends, is not legal in many countries, but then it is actively practiced. Many smaller cities in India, rural places in India, they deny life-saving treatment to newborns who have spina bifida. And in turn, this works like passive euthanasia. So I am very strongly feeling that this is an area where the International Federation should take a very strong stand. Again, coming to tertiary care, having visited centers in the US, then North America, Ireland, Europe, even in the so-called developed world, I find that care of incontinence and proper surgical management of incontinence is lacking, maybe because of lack of experience and expertise. And there are very good operations to make these children much, much more socially continent than they are in many parts of the world today, whether it's the developed, the Western world, whether it's the North countries or the South countries. And we need to look into some of the specialized medical expertise which should be made accessible to more and more people across the world. Then we come to some of these issues, and we all know how important inclusive schooling, employment is for the development of a child with spina bifida. And I know all organizations, associations work towards that, but it is something which is absolutely essential, and no special schools are required for these children. They must be educated in normal schools, and the education must be inclusive. Marriage and fertility is eminently possible and needs to be, families and individuals need to be counseled properly for some of these issues. Okay, so let me come to the last slide. And I believe these are the few issues which are listed in this slide as the way forward for the International Federation in collaboration with all the other associations. Then, and let me just quickly read out: prevention, awareness, and food fortification, national birth defects registries, our united voice against euthanasia, a mechanism to make some funds available for medical care, maybe insurance in countries where it doesn't exist. Then tertiary care expertise development. We should certainly look at exchange programs between countries and families and associations. We must aim to get associations in every country. And with the newfound use of Zoom and technology, we can have online counseling for spina bifida individuals and families on across the world. And of course, lastly, webinars such as this and the others that we did to share knowledge between all of us. With this brief overview, I thank you all for being patient and listening to this presentation, and thank you very much.
Thank you, Dr. Karmarkar, for this excellent presentation. Something that I definitely take out of it, that we have work to do still ahead of us. Huh? So we're talking about an important health problem, clearly in need of primary prevention, but also secondary and tertiary prevention. And it is stunning that if we look at your pictures, that still a large part of the world, we lack efforts. And if we have efforts, we must question the effectiveness of our efforts. So thank you for highlighting this to us and to the audience. I was just looking if we have received any questions in the chat box, but I cannot see any specific questions for now at this moment. I will just give it a brief time. Okay. I think we can move on to the 5-minute presentation. So I'm going to share my screen again. One moment for the audience. It always takes a bit of time to get this installed. We are now moving on to the 5-minute presentations of the other panelists. And we are starting with Engineer Dr. Kribanandan from Malaysia. And Dr. Kribanandan is the Vice President of the Spina Bifida Association of Malaysia, SIBIAM, and he has been spearheading the linkages between SIBIAM and Rotary for over a decade, and more recently helped set up the Rotary District Action Group on Spina Bifida and Hydrocephalus in Malaysia. And he has always been passionate about the rights of disadvantaged communities and also keenly involved in sustainability and the efforts for the protection of the environment. And he's increasingly devoting his time to these endeavors. Dr. Kribanandan let me know that before returning to Malaysia in 1993, he also studied and worked in the UK for over a decade and spent several years in Botswana in Southern Africa, where he has involved in sustainable design, delivering appropriate housing technologies and identifying water resources for rural and desert communities. He furthermore manages an engineering consultancy based in Kuala Lumpur, Malaysia, providing specialist designs and technology services to the construction sector. So Dr. Kribanandan, it's a pleasure of having you here, and we look forward learning more from your work in Malaysia. The floor is yours, and if you want to change your slides, just let me know by next slide, please.
I can't seem to get my video on Sylvia. Could you help with that?
Yes, let's ask for assistance. How can we make the video work for Dr. Kribanandan? Yes, it works.
Thank
Excellent.
you. Thank you so much, Sylvia, for that very kind introduction. Let me begin. If you can, maybe you could pull up the first slide. Okay, thank you. Good evening, everyone. It's quite late here in Malaysia. It's about 9:30 in the evening. I'm sure we have many time zones today to deal with. Firstly, I'd like to thank Sylvia Roozen and of course Dr. Karmarkar, Dr. Santosh Karmarkar of Federation in India to help make this webinar possible. I think it's an excellent idea, an excellent start. So if I could begin, next slide, please. A bit of history of the Spina Bifida Association of Malaysia. The organization was set up in 2007, arising out of a conference a year before. And today we have a growing membership, and the organization is quite central to raising awareness of SBH in Malaysia. Our focus, of course, has been protecting human rights of the SBH community nationwide. But we've also been looking very much at providing tangible assistance, both advisory as well as physical. And I'll come to that in a short while. Of course, a lot remains to be done, but it's been quite a eventful 10 years or 13 years rather. And certainly in the last couple of years, we have grown and our influence has also grown. Next. Just some slides to indicate our recent journey, some of the activities we have done. Right at the top there, you can see that in 2018, we organized a conference called entitled the Educate to Elevate Conference. This was basically to raise awareness and it was done in the East Coast, very well supported in terms of awareness. We had huge presence, both from the healthcare professionals as well as families. But it was a very important event also for engaging with the Spina Bifida families in an area we were not very familiar with outside of the Klang Valley or the Kuala Lumpur area. If you go right to the bottom, in 2019, we carried on with these conferences in two other cities, in Sungai Petani and Johor Bahru, both in the north and the south, again, to raise awareness, but also to use the opportunity to connect with families in those areas. And these were also very successful. Dr. Karmarkar has mentioned the 28th International Conference, which was in New Delhi, which we attended, and it was an excellent conference for making linkages. And thanks to that, we are here today and presenting with IF and taking this forward. Also in 2018, we started a working group within the Rotary District 3330 to spread awareness and gain support. And I'll come back to that in a short while. Of course, with the COVID shutdown, we've had problems with trying to do physical work on the ground, but that hasn't stopped us in terms of engaging with the SB community. We did an interesting class with music in terms of with our SB children, and that was very well received, and we hope we can carry this on further. Of course, today we are here with the World Federation and IF, and we can move forward from there. Thanks. Next slide, please. The main message we'd like to share, of course, is the centrality of having an organization like SIBIAM in Malaysia. And collectively, we have identified needs and provided a multi-pronged range of approaches to overcoming the many challenges which the SBH community faces. Also, in the last 10 years or so, we have forged links with the Rotary movement, and this has become part of our outreach program, which I will share in a few other slides. Next, please. This is the current leadership trim. Some of you who were in Delhi would have known or would have met Professor Amaran. So it was an excellent meeting. The background there is one of our AGMs. You can see a whole host of families and children and parents and so on. Next. The activities we have been doing are manifold. Of course, awareness and education is central to this. Assisting needy families, and I will show you some slides later on some of the financial support we've been engaged with. Connecting with families and members, particularly to do with healthcare and linking them up with the professionals. Networking so that the families are meeting and also sharing perspectives of SB care. And finally, of course, fundraising, without which none of these activities can be possible. And this is something which we have had to do quite a bit of. Next. This is some of the kind of financial assistance we've been giving. You can see a whole range of costs there and different aspects. It could be as simple as some transportation requirements for a medical care, or something a bit more involved, like a special custom-made wheelchair, which is required by one of our members. So we've been identifying our needy members who need some help. And of course, again, fundraising becomes central to providing these kinds of support. Next. Just a few images here of the IF conference in August 2018, an excellent event. And let's hope we can have something similar in the near future. Next. So what are the biggest challenges we face? Of course, sustainable funding is a key problem, and something which we need to do continuously. So the solution we have come up with really is to engage with partnerships with other organizations. And this is something we have done quite successfully, and this is something which I'd like to share in the next few slides. So in 2018, we helped set up this district action group on Spina Bifida and Hydrocephalus in Malaysia with the Rotary District 3300. And this has become quite an interesting way of moving forward in terms of involving a wider sector of our population. Here we have got Rotarians together to look at the interests of children and adults with Spina Bifida and its related disorders. We are, of course, looking at practical and meaningful projects, and I'll share one or two of these. And of course, we were formally recognized in 2019, and this has now given us the possibility of moving forward in this lane. Thanks. Next one. So one of the first things we've done more recently has been to apply for a global grant through the Rotary International in this area of disease prevention and treatment. It is to raise awareness, to enhance knowledge, to look at the requirements for health and multidisciplinary care, encourage networking and linkages between the families, and also to develop ideas of service centers around the country as focal points. So the goals are to improve knowledge and capacity of our local healthcare professionals as well as carers. and finally to enhance the health infrastructure. And this is a project we have already submitted for funding. We have not received the funding yet, but we are very hopeful that this will go ahead. Next. As part of this project, we had to do a fairly comprehensive community assessment to be able to support the grant. And this has been very interesting for us because it has given us some idea of how our SB community and what their needs are and so on. But we can't share too much at this point in time because of time limitations, but this is something which we will share in future. Next. So the grant itself is being organized in 3 phases. The first phase will be bringing together all our health professionals and carers who have been with us on this journey for the last 10 years, and to bring this knowledge together to set up the preparation of training materials so that we can actually start doing the training of trainers in phase 2 with that material. So this is what we are intending in phase 2, to train the trainers, about maybe over 25 to 30 people, and then field these trainers out to the regions, different regions of Malaysia, to do the awareness training workshops. We've identified 7 locations at this point in time based on the budgets we were able to apply for. And hopefully this project and program will become part of our move forward in terms of raising awareness, as well as linking up the SB community with other organizations like the Rotary in moving forward. Next. So the workshop goals are several. We aim to enhance relationships with the various ministries, because that's important, particularly in terms of the issues of fortification and so on, but also in terms of records. I know Dr. Santosh showed some figures about incidents in Malaysia. Frankly, the records here are very poor, and this is something which we are trying very hard to overcome. Then we are hoping that the trainers we are going to identify will become resource persons, long-term resource persons for SIBIAM. And then you have the parents and the caregivers who hopefully will form support groups and continue to provide support to the existing and newer members. And finally, of course, the trained medical professionals who we hope will then become the links to the secondary and tertiary care hospitals. And I think this is very important indeed. Next. So these are just some images of some of our recent activities. You can see the Spina Bifida Awareness Day on the left there. This is the conferences we are organizing. We are calling them Educate to Elevate, because that's precisely what they mean. We're trying to get people familiar with some of these issues with the SB and the care which is required, and some of the other images there. So on that note, I will end my presentation, and hopefully we can engage in a dialogue after this, and I look forward to that. Thank you.
Thank you so much, Dr. Kribanandan. This is an excellent overview of the work you're doing in Malaysia. You mentioned it's recent, but it's already a very powerful journey. So it gives us at least the impressions of that one is very active in Malaysia. Still there's work to do, but I think that counts for all of us. And I appreciate also that you shared some of the solutions that you have found to obstacles you faced as well. So we trust that your grant will be funded the soonest, so you can continue the work. Thank you for sharing the presentation, and we look forward to welcome you in the panel discussion to have a good discussion on the way forward as we are here with the global partners. It's now a time to move to the next presentation. It's a presentation of from Norway. It's by Hans Christian Norseth. There won't be slides for this presentation, but I'm going to introduce you to Hans, and I will ask Hans to already show himself on the video. So Hans Christian Norseth is 50 years old and from Oslo in Norway, and he has spina bifida. He lives together with his wife and a little dog. I'm not sure if we will see the dog also in this video. But Hans Christian let me know he's a very active member of the Norwegian Association since 1991 and has been a board member in Norway for 10 years. But I can also share with you he's very active in Scandinavia in general. And the last 3 years, he has been a chairman of the board and last spring he had to leave and turn this over to another person. Hans Christian is currently the vice president of the Norwegian Association as such. And in the association, he works with international works, like a follow-up on the connection with us as international federation. And he has the responsibility in Norway for a Nordic cooperation with Denmark and Sweden. And also he works on prevention aspects like folic acid and fortification. And of course, there are many, many other activities that Hans Christian is involved in. So we look forward learning more from your work and the journey in Norway and Scandinavia. I know that you did not wanted to put up slides. Do you want me to close this presentation so you can speak freely?
Yes, please. So, thank you very much for inviting the Norwegian Association as well to say some words in this webinar. It is very nice that we can be a part of this worldwide organization, and that we can share some information that we have and get some information from all over the world. So thank you very much. The Norwegian Association was started in the middle of the 1970s, and we have been a part of IF since the beginning of 1980, when everything was started. So I think that we have been one of the countries that have been working with Spina Bifida and Hydrocephalus for more years than other countries. But there are also, of course, many countries that have been working together with us. Our association is maybe a small organization. We only have just under 800 members, and from that there is approximately 500 to 600 with Spina Bifida or Hydrocephalus. We are working. The main goal for our association is to arrange courses for our members, and we want to arrange social activities for our members so that they can get together and have fun together. Maybe not much of talking about the diagnosis, but just to have fun and to see and experience other people, to see what the good things are from having our diagnosis. But also we have our main board in our association, and under there we have one person working for the daily works in the association, and under the main board we have different kinds of regions that is trying to arrange things for the members who is living within these regions. We are just in the beginning of working with folic acid and fortification. Our government we have tried to talk to the government about this for many years, but not until for 2 years ago we had a very good meeting with our government, our association, and they were very interested to hear about the things that we was going to talk to them about, especially this about folic acid and fortification. But they are a little bit anxious to try to start working with it, because they have read many old reports about fortification, and what they say is that it's possible to get some cancer and things like that. And we have tried to say to them that this is not it's not that dangerous anymore. So we hope that we can start working with them, and that they will listen to us about these topics about folic acid and fortification, because we can see that it will help to that there isn't that many people being born with the spina bifida. And we are also working a lot now to make the best information that we can get and give that to the health department in Norway, and so that they can give out the right information to the doctors and the health care in Norway, so that they don't scare the people who is going to have newborns with spina bifida and hydrocephalus. Another topic that we are very that we are working a lot with is aging with spina bifida and hydrocephalus. The topic is much more for spina bifida than hydrocephalus, unfortunately, because we have a team in one of our hospitals here nearby Oslo, and they are per date they are just working with spina bifida, but they are trying to find out more about how it is to age with spina bifida. Another topic that we are very much working with is work aid in Africa, and the last year we took this this work home to Norway, because our government said that we had to do that. So this is a very new topic for us. So we are just in the beginning of this also. So, but we have been doing this for many years, but not just in Norway. So that is also a very interesting topic to work with. And we have also now tried to work more for our members with, as we call it, just hydrocephalus, and not spina bifida with hydrocephalus, because we have a lot of members with only that has only hydrocephalus, and they wanted us to start working more for them. So now in the beginning of November we are going to have the second course for these members. So that is also a very exciting topic for us. And as Sylvia mentioned, we are also having a good cooperation with Denmark and Sweden. And once a year we are meeting them to give and get some information how they are working in Sweden and Denmark, and we're also trying to have Iceland and Finland as well in this work, but it's not that simple or easy to find the right connection with them, because much of this is cost a lot of money, and in Norway we are very lucky to have a lot of not a lot of money, but enough money to try to cooperate with other countries, and that is one thing that I hope that IF can contribute with in the future, so that we can cooperate across borders in some kind of way, so that we can exchange information from country to country. So that should be most of what I had to inform about.
Thank you, Hans Christian. It's a great example of exactly what you say, the cross-border cooperation that one needs to find to make a change happen, literally. And it's also good to hear your involvement with your government, how you try to find your ways together with your government to have effective prevention measures for Norway, but also to learn from each other. And I think that's all what it is about, especially on such a day like today. And luckily, we also did not need to spend flight hours and money for the flight to see each other for today, but we had a platform available. So thank you for being here, Hans Christian, and also welcome. I would say welcome to join the panel discussion later on. Thank you, Hans, for sharing that.
Thank you.
So with that, I'm going to look if there are urgent questions already. I don't see them coming in. Just so you know, the social media team is in the background also very active in connecting with you. I'm going to share with you now a story by Sara Struwe. So we're going from Europe to Central America. And Sara Struwe joined the Spina Bifida Association in late 2009 as the Chief Operating Officer and became CEO in 2014. She leads SBA's efforts to develop the new Spina Bifida Collaborative Care Network, which is a system which monitors, tracks, and evaluates care provided in Spina Bifida clinics and other healthcare settings. Under her direction, the SBCN network is developing the necessary relationships to adequately communicate between the SBA, clinics, healthcare professionals, people with Spina Bifida and their families, and organizations supporting people with Spina Bifida and the SBA chapters. So here again, another example of how we need to work together across disciplines. Sara sends you all her kind regards and her apologies for not being present here today live, but she sends a 5-minute video to be shared with you and her message for today's World Spina Bifida and Hydrocephalus Day. Fama, I'm going to ask you if the audio is not working, please let me know.
Hi, I'm Sara Struwe, President and CEO of the Spina Bifida Association of America. I'm sorry that I can't attend this meeting in person, but SBA is hosting our National Walk and Roll for Spina Bifida today. Thank you, however, for allowing me to share the work of SBA and its many volunteers. In 2019, the Spina Bifida Association changed its mission to a simple but powerful statement: Our mission now is to build a better and brighter future for all impacted by spina bifida. We accomplish our mission through our 5 pillars of work: research, clinical care, advocacy, education and support, and network building. In research, SBA establishes priorities through a variety of ways. SBA created a research advisory council comprised of care partners of people with spina bifida, adults with spina bifida, healthcare providers, and researchers. This group is drafting our first community-based research agenda. This agenda will guide research to address issues that have the greatest impact on the daily lives of people with spina bifida. Last year, a father approached us and shared that his insurance company would not cover the catheters that his daughter required. In our advocacy work, we connected with other organizations that said they were hearing similar issues. We now lead a coalition of organizations to develop, distribute, and summarize the results of a survey to determine the extent of this issue. From the results, we will build a collaborative strategy to address this issue and any others we find. SBA also supports research efforts by other organizations. We partner with them in the design and implementation of research. Any researcher interested in working with us should contact us. Finally, SBA participates in the National Spina Bifida Patient Registry at the National Center on Birth Defects and Developmental Disabilities at the Centers for Disease Control and Prevention. This registry, now over a decade old, has over 10,000 participants in it that range from birth to over 80 years of age. SBA supports the funding of the registry through its advocacy works, and we also collaborate on an operational basis with the center to influence and distribute the research conducted through the registry. The Spina Bifida Collaborative Care Network is a program of SBA that ascertains the needs of people with spina bifida, connects with the healthcare providers, identifies clinics with the best outcomes, and pinpoints research priorities. Its first project was the Guidelines for the Care of People with Spina Bifida. The guidelines were developed to provide every healthcare professional, from generalist to specialist, a roadmap of the best evidence-based and expert treatment available from birth through adulthood. 100 spina bifida experts from around the world spent 3 years developing these guidelines that cover 24 different topics. The guidelines are available on the SBA website or through a mobile app. Both are free of charge. SBA works with clinics in the registry to understand why some clinics have better outcomes than others. Our findings have the potential of improving the health of people with spina bifida across the United States. Clinics who become SBA clinic care partners implement best practices so that people with spina bifida receive the best care possible. Clinicians who treat people with spina bifida can attend the clinical care meeting, which provides updates on best practices and opportunities to network with top experts in the field. Additionally, SBA is involved in development of transition and adult care models. We hope to be able to find out what models work best and provide the evidence to support that. SBA's advocacy initiatives are determined by its new advocacy committee. Comprised of adults with spina bifida and care partners of people with spina bifida, this committee oversees Till on the Hill, SBA's Advocacy Day, in which individuals and families from across the United States advocate on the federal level for issues important to the spina bifida community. It also oversees the work with other organizations on issues that impact people with spina bifida and people with disabilities. It also oversees the creation of a state advocacy program for SBA chapters and other groups. SBA provides a series of education days, now virtually, with leading experts on a variety of topics. One of the most popular programs is SBU, a virtual education program that pairs professional experts with real-life experts to discuss any number of topics. During the pandemic, we've also begun to offer other singular topic webinars for a variety of audiences. Our new SB Connect program is designed to connect people with spina bifida to others with spina bifida on a local level. Each year, thousands of questions are answered, and people are connected to valuable resources through our National Resource Center. Our website is designed to provide all the information that SBA has, but at your convenience. The traffic on our site grows annually. SBA is building networks through a variety of means, like our SBA chapters, which lead the way in building a better and brighter future for those impacted by spina bifida on a local level, or through social media by providing a forum for people to gather and support and learn from one another, and by growing our web presence and expanding the information available on our website. If you have more information, please check out our website or reach out to me or Sheila Roy, SBA's Chief Operating Officer. Thank you for this opportunity and happy World Spina Bifida Day.
Well, thank you, Sara. Thank you, Sara, for taking us along on your journey in Central America. I just saw a change in my screen. That all went well. Was there a technical issue? No technical issue, okay. Okay, good. So, just for the audience, how are you doing? Because we have great speakers for today, and we still have 3 5-minute presentations to go, but also the testimonial stories that we want to share with you. So, how are you doing?
I think, Sylvia, it's going very well. I can see that there are more than 100 participants, and the number has stayed the same. And there are a lot of interesting comments and a few questions which have come up, which we can discuss after the remaining presentations.
Excellent, excellent. Thank you, Dr. Karmarkar, for sharing that. Then I'm going to introduce our next speaker. I'm going to share my screen again, one moment. Okay, so we are moving now from Central America to Russia, and it is my absolute pleasure to introduce Anna Polevskaya, and I'm going to ask you to already show your video and start to unmute yourself. So Anna is from the Russian National Association located in Moscow. She's the managing director of the National Association, and it's so good to have you here with us today. You recently filed an application to join the International Federation, so we are very happy to also hear about your activities, because I know that your Russian Federation is also very active. So Anna, the floor is yours.
Thank you, Sylvia. Thank you, Dr. Santosh, for invitation. And I'm so happy to be here and having an opportunity to tell you about our activity in Russia. We support the families which faced with spina bifida. Next slide, please. And I tell you a little bit of history. The foundation was created in 2016 by Inna Inyushkina when he had a son with spina bifida, and at that time she couldn't find any organization which helped such people, and she decided to create a fund. And it was easy to start, but later we had more questions than answers. Next, please. Firstly, it's bad diagnostics, and the pregnant women learn about spina bifida too late, and they couldn't do fetal surgery Secondly, there are a lot of cases when the women give up their children after birth because they are scared, because they had no support, and they don't know what to do. Thirdly, there are no medical and social adaptation programs in Russian healthcare system. And also very expensive medical means of rehabilitation, and which not covered by insurance. And finally, poor barrier-free environment. All of this is inspiring our teams to action every day. And now Foundation Help System consists of several different programs, such as pregnant women's support, home visiting by ergotherapists or physical therapists. It's help for orphans, sports online as a daily rehabilitation, neurological help, legal assistance, psychological support, and education of specialists and parents. For the last 4 years, we helped about 400 children, and we began good at medical and social fields, but one problem still not solved. It's the research of causes. And my main message today to the colleagues is that we are glad to cooperate with you in searching of reasons of spina bifida. And we will be grateful any information support of our specialists in Russia. Son, he's 8. He is a very active boy. He has
Now we're going to move forward. We're going to move to Ruth. Ruth Nalugia. And Ruth is the national coordinator of Spina Bifida and Hydrocephalus Association in Uganda. And Uganda, it's the acronym of SHAW, as you can see in the logo. It's an umbrella association that was started in 2015 by families and persons with spina bifida and hydrocephalus who were committed to improve the quality of life for the persons with spina bifida and hydrocephalus and their families, and also to reduce the incidence of neural tube defects through awareness and raising and harm rights education. Ruth is furthermore a parent of a child with SBH and social science researcher at a medical research council in Uganda. Also, Ruth sends her apologies. There was a connection failure earlier today, and it's still going on, unfortunately. So she sends her apologies, but also sends a video with her words to be shared for today's World Spina Bifida and Hydrocephalus Day.
Name is Ruth.
I just want to warn the audience, the video is a bit low in sound. This is not something we can improve, unfortunately, so please put up the sound if you cannot hear it. Okay.
Name is Ruth Narija, the National Coordinator for Spina Bifida and Hydrocephalus Association in Uganda. Uganda is a landlocked country and a country known as one of the least developed countries. But we understand that it's a state party on numerous human rights conventions, child rights. And so at Shell, we are trying our level best to follow, to put into context these human rights as our country obliges or pledges to protect, respect, and promote. So our human rights approach at Shell, first of all, we believe in the UNCRPD Article 4 that says nothing about us without us. So we pick our approaches from there, that we have a responsibility as caregivers, as children, as youth, with living with Spina Bifida and Hydrocephalus, to put this into context by one, giving out to our participants, the stakeholders, our partners, giving them human rights education. Because before you claim for anything, we believe that information is key. So we give human rights education as a way of protecting human rights. Secondly, we put in place policies that continue to support our children's existence, like child protection policy, because so many times caregivers and other people tend to use children, hence violating their rights. So at Shell, we have child protection policy, and it is very key as we work with the children. And three, we have we put in place practical human rights interventions. For example, like Uganda has very good policies, but when you analyze them, most of them are not being adhered to. So at Shell, we want to live an exemplary life. We want to be model. First of all, we empower youth as self-advocates into this. So that is a practical approach. And secondly, we also have interventions that are very practical, tangible, like inclusive education projects that we are implementing of late. We do modification of schools. We bring on board different stakeholders to sensitize them about inclusion. We engage parents, we engage their peers as a way of living an example that there is a need to strengthen the systems. So as we commemorate the World Spina Bifida Day, I say it is the duty of all stakeholders to uphold, to put into context all human rights that promote, that intend to improve the lives of persons within that particular area. So I call upon every stakeholder, young and old, high and of low profile, to make sure that we stand in our respective positions to be able to protect, promote, and fulfill the human rights obligations per our countries. Thank you.
And thank you, Ruth, for sharing that. I trust the video for the sound was a bit problematic for many of us, but I trust the audience could still follow and hear the words from Ruth. Ruth shared with us that SHAW stands for something that we all relate to, nothing about us without us. And therefore, it's good to see how Uganda has practical interventions and also empowers communities and strengthens skills on local level to be united and straightforward for the human rights. It's what Ruth said in the end, it's a duty that we have to all stakeholders to uphold the human rights for people with disabilities, and in particular Spina Bifida and Hydrocephalus. So thank you, Ruth, for sharing your words all the way from Uganda. I need to stop sharing my screen. I have some technicality problems here. And thank you for the audience for being so kind and patient, because When it comes to technical aspects, it always takes a bit of time.
Yes, we can see your screen.
Thank you. Thank you. So this is the slide that Ruth asked me to share with you as well. For Uganda, the prevalence is estimated to be 6,000 a year. And it's what she also emphasized, that there needs to be a dialogue with not only the community, but also the ministries and other stakeholders involved to ensure that nobody is left behind. So we hear you, Ruth, and together with, of course, also all other members today here with us, we strive for the human rights for persons with disabilities. Now we're going over to South America, and I trust Elena has found her way to connect also to the slide of this presentation. I want to introduce you to Elena Zappoli. Elena is our president of the International Federation, but she's also the president of the association in Argentina, the APEBI. And Argentina was created in 1975 and is dedicated to the development of prevention, assistance, recreational sport, rehabilitation programs, all for people with spina bifida, hydrocephalus, and also other disabilities. And APEBI works with other organizations and institutions to create safe spaces for discussion and exchange, enact laws, establish prevention plans, and carry out any action that assists in promoting equal opportunities for all. And they also provide information on spina bifida, legislation in Argentina, and the unique certificate of disability that helps people with disabilities access benefits, such as the comprehensive coverage of basic rehabilitation benefits and comprehensive medication coverage. And their projects across Argentina, but also Latin America. So Elena, without further ado, I give the floor to you, and please let me know when I can change the slide for you.
Thank you, Sylvia, thank you everybody. And I want to begin my speech giving the thanks to many people who preceded us. And of course, to the youth group, at least in my country, there are 5 persons working a lot for everybody. And I would like to mention them. They are Mayra, Diana, Daniela, Yanina, and Steffi. They are there, though they don't speak in English. They'll try to read what I'm saying. Thank you, Sylvia. This is the APEBI house. It is our house, and they are nowadays are working nearly 50 persons, 50 professionals working for our sons and daughters, for the person with the spina bifida. Yes, the second. APEBI was founded in 1977. The idea was from family leaders concerned about the best quality of life for children with this condition. And I remember that one of our best doctors had traveled to England, and there he knew the association, and he brought that idea and shared with us to begin doing the same in our country. Yes. The following. We work on community building, and here I throw some photos. For instance, how to communicate, because if we don't do that, people don't know any rights. We have to communicate so people can defend themselves. We prepare many marathons. The upper photo on the right is during Spina Bifida Day that we close the street with all that implies preparation, being ready for that. and we closed the street, and all the works done inside Apevi were shown to the neighbors, to the different communities. Downstairs you can see our beautiful Murga workshop. Murga is just a popular dancing and singing, and they use, of course, the colors of Apevi, green and white, and they sing songs against discrimination. Meanwhile, they are acting that they act all over the country during the whole year. They give people a flyer explaining about this condition, about prevention, with a telephone number, a free telephone number that is written on in the flyer, no? Yes, the following. Well, here I can explain that APEVI works on primary, secondary, and tertiary prevention. And so as to explain something, we can see our big room in the sport place. There we can see all parents in some of the workshops or conferences. We can see persons with spina bifida, professionals, healthcare professionals, teachers, and families, Of course, the person with the spina bifida is always there. In the middle, you can see a photo from the place where we held the 25th International Conference in 214, and people from over the world came to our country, and that was wonderful. I remember it was a great effort, but it was really unforgettable. Well, there's a part of the basket on wheelchair persons. Some children are in the swimming pool. They also go camps. They go to different cities with the teachers, the persons who take care of them. Because in Apevi, we have persons that could not go on studying, they could not enter the high school because that part of the people could have not any other places to go. It is completely different with the persons like the ones I have just mentioned, that they are professionals. We have doctors, lawyers, psychologists, psychopedagogists, and so on. The public relation professional. Well, the following, please. Here, when I was talking about prevention, when the Murga, as I told you before, is acting, they give this flyer with information about prevention. And every year for the International Day, a group of persons from Apevi go to some important football team, football club, to show about prevention. Not this year, because due to the pandemic, we cannot be outside. Of course, everybody has to take care of COVID. Very, very sad, At the end of the slide, you can see a book. That book has very important information about the rights, especially the rights of spina bifida people and healthcare settings, and of course, as well as social context. No, it is everything written in a very simple lay language. Yes, the following. Well, here you can see the people at the day center. They have got friends. Some of they are in love with one of their mates. They go on holidays. On the downstairs on the left, you can see one lawyer, a person with this condition, Valeria, who is sharing with Janina, another professional with the spina bifida, a workshop with people from the day center, and especially making them know the Convention on the Rights of Persons with Disability. Yes, the next, please. Well, and talking about advocacy, we during 2018, the Folic Acid Act was passed. That was wonderful, stating that women of childbearing age are given folic acid for free in our city. This act also establishes that primary prevention must be promoted and awareness-raising campaigns are always organized. There we are with one person representative of the government, and that was, we can forget this day, and we are working in our Congress, so all our legislation will be working for a Folic Acid Act, but for the whole country. Yes. The next. When we had got many chapters all over our country, we did to begin working for Latin American countries. The first trip we had begun was in Bolivia. There you can see Carolina Fernandez Chavez, who is a mother of a beautiful baby with a spina bifida, and she and her husband are very committed, and they are working in not only in Cochabamba, because they live in Santa Cruz, and with different cities. She is working a lot. We could go there. Dr. Santiago Portillo always helps us as a volunteer, and I gift prize during our conference. That was really fantastic. And on the left, we can see Dr. Portillo, Carolina Chavez Fernandez, people from APEVI sharing that place, that it is a home where people make charge, and so they take care of those babies and children from all over Bolivia. When we went there, we realized that they did not count with chance, and so thanks to our partners, our stakeholders, it was wonderful to send chance to Cochabamba and to Santa Cruz de la Sierra. There in the map you can see where Bolivia is now. The next slide. After that, the following year, we went to Ecuador, where we met Patricia Rodriguez and her husband. She is just like Carolina in Bolivia, our best leader too. And there I have a a photo with Liebenbauer, who had been invited by Riadis in Ecuador, and so Patricia shared the meeting with Ana Lucia Orellano from Riadis. And there Patricia is working with more than 50 families all over the country. Yes, the following. We decided the following year to go to Nicaragua. And there we have the photo of Scarlett Real. She is a mother too of a child with this condition. There you can see Dr. Juan Bosco, a wonderful person. We have been working by Skype, and as soon as the moment practically arrived that we had to fly to Nicaragua, a very critical and social economic situation began there. We could not go, but we did what we had to do. It was to send them shunts and catheters because they needed them, and they are always asking for some help because this country is living a very bad situation, no? And so I can't leave mentioning our stakeholders if that is always helping to these countries, and Child Health, and Laurita Tejado from Miami, who is also one of our stakeholders. Yes, the next one. Well, here we did not go there, but we are always in contact. Now it is easier thanks to Zoom, no? The pandemic, the only best and wonderful thing that brought everybody is that we can meet each other by Zoom, no? There is Mr. Luciano Moreta, and it is a very bad news. Some months ago, we received the news that Caridad, his daughter, had passed away. And shunts and catheters were sent to Dominican Republic too. Next slide. Well, here I can present RENAPRED. It is an NGO, a very strong NGO in Mexico, where Federico Núñez Perea and his daughter Stephanie Núñez Iturrieta work very much, and it was, we know many years ago, since 2013 we worked together, but last December we could get the 4th Latin American meeting there in Mexico. It was wonderful to meet 11 countries that we did not know ourselves. Only by some emails we could share, but it is different when you can meet the others and share so many experiences. Yes, the following. Well, and we worked together and we shared that meeting last December with people from Guatemala, Helmut, with Gona. Gona is taking ahead a program there, but she is from the Netherlands. Well, in the middle we can see Colombia. We know with Colombian people, especially with Sonia, who is the president of Mónica Uribe por Amor. That is her NGO, where Claudia is always sharing a lot of work with Sonia. And there we can see in Paraguay, Mrs. Rosa Maria. Rosa Maria has a boy with this condition of a spina bifida, We knew last December, but we worked together during every need that she or a baby may share. And for instance, we have made changes with some professionals to help in different subjects. Yes, the following. Well, here we have Costa Rica. Costa Rica with our dear Ana Laura Jimenez. She's a doctor in medicine, and I knew her, and a baby knew her during our 25th conference in 2014. She works a lot in Costa Rica together with Claudia, that is another mother from that country. In Panama, we share information with Lara Rosamena, and with part of the government too in Panama. Then I can mention Chile. Chile, they are, it is a country beside Argentina, as you can see in the map. There we can see in the photo, we can see Cecilia Alarcón and Claudia. So they are, Cecilia is the president of CORPEP NGO, and we work together with them too. Yes, the next slide. Well, I want to share my mission to go forward for the future. And which is my mission? I think here you can read that I can do things you cannot, you can do things I cannot, and together we can do great things. Well, that speech is not mine, of course, it is from Mother Teresa, but at the moment I feel very united with everyone here in this webinar. Thank you. And the last one. This is a part of a wall in a PEBI where our persons in the day center decided to paint this mural. And there in Spanish, we can read that it says, todo lo que das en la vida te lo devuelve. Everything you give during your life, of course, life gives you back everything you have some time share with some other people. Thank you so much and have a good day.
Thank you, Elena, for sharing such a beautiful and also colorful presentation of the many, many, many activities that you are involved on behalf of the Latin American countries. So it's impressive to see all the work that has been going on for the past years. And having said that, I absolutely agree with your mission, even though it was formulated by somebody else, but let's do it together to move forward. And having said that, I think looking at the time and the talks that we just had, it's time to get all the speakers now involved in a panel discussion. I just see also that I have missed some chat messages, but I can see from the number of attendees, it's still nobody zoomed out as such. So thank you for bearing with us. The meeting is going, takes a bit longer than we anticipated, but it's important to spend this day together because it's the World Spina Bifida and Hydrocephalus Day. So it's all about sharing that together. As an opening, let's see if everybody comes back. Santosh, I still miss people for the meeting. Yeah. This Anna. Yeah.
No, there are some Sylvia, there are some questions and comments which have come in the chat box. Made a few notes of those questions. So I'll just go through some of them. So that there was one question from Papatia. I think she is from Spain, I'm not too sure, Greece, but she was asking about the prevalence figures that we showed, whether it takes into consideration the cases where abortion or termination of pregnancy has been done. So to answer her question, it does not take into account the MTPs or the terminations. The figures that we showed, that I showed, are prevalence in as per number of live births. So it is postnatal, does not take into consideration fetuses which may have been aborted or terminated. There was one question from Dr. Kribanandan himself, a comment and a question inquiring about fetal surgery. So you want to ask that question directly live, please.
Yes, thank you, Dr. Santosh. Yeah, I just wanted, I mean, you mentioned this, and just wanted to know, whether this is being performed in India quite extensively, and what are the risks and the costs, and how are you managing this?
Yes, so it has now been medically and proven that fetal surgery is far better than surgery after birth. It, it definitely reduces the incidence of hydrocephalus. It decreases the neurological deficit, and it reverses what is known as the Arnold-Chiari malformation. So if you have a choice to do fetal surgery or to do surgery after birth, fetal surgery is now definitely a more clinically better option. Having said that, nothing, no operation is without some risks and side effects. So the only major risk in fetal surgery, or I would say a side effect, is that a lot of these children are born prematurely, and therefore they may require to be in the ICU, the neonatal intensive care unit, for a longer period of time. So otherwise, it's not very expensive. No special equipment is required. You require the same equipment that most tertiary care hospitals across the world have. So that way, it's not a very high-tech, hi-fi, costly cost. There was one more question, Sylvia, if I can ask. It was from, let me see. Yes, from somebody in India, Archana Patil, and she was asking, what is the connection between spina bifida, hydrocephalus, and intellectual capacity of the individual? So, well, let me answer that. Every spina bifida child, at least maybe more than 95% of them, if they are promptly treated, if their hydrocephalus is diagnosed as it should be within the first few months, first 6 months of life, and if you do a shunt operation, all those individuals intellectually should be completely normal and can be neurosurgeons themselves. So I think that should answer most doubts that people have about intellectual capacity with spina bifida and hydrocephalus. Okay. Then there is somebody, Brian Kalule. I don't know from where, but he also mentioned about being concerned about the Groningen protocol, and he feels that we should certainly raise our voice against such protocols and efforts. So that was more just a comment, not a question. Well, that these were the few questions that came up, and there have been a lot of other comments and some individual enquiries about very specific aspects of medical treatment. But considering our time, I don't think we need to answer that in this session. So they can connect with us individually. Yes, Sylvia, back to you.
Thank you, Santosh. And I'm sure many questions and comments will also follow. I just saw a comment from Nigeria coming by that we have lots of work to do. And that's absolutely true. Wherever we are, I'm sure we still have lots of work to do. But today it's the first online event that we have together to celebrate the World Spina Bifida Hydrocephalus Day, but also to reflect on how far we have come, to raise our voice and to raise awareness and effective prevention. So my first question to the panel is, it's nothing about us without us, but how far have we come and how are we doing on an international level? What are your reflections on that from today's presentations?
Elena would like to answer.
Well, I am sure that we are doing our best in every country, but we need, I think that the best reflection I made that is that pandemic is helping us to think on the other person we have at our side. If we don't see what people need near us, not, of course, not only with the condition of our children, no, but in every person, and we can share at least our knowledge, that we will be the best for communities. And of course, my best wish would be that there won't be a need to have a convention on the rights of people with disabilities, because there, inside the convention, you can see what their rights are. And if they are rights, they must be part of everyday work. And, well, we are far from that in all conditions, but we have to work on that. There's no need to be together only to talk about one disability, but all persons with disability are a person. And so God bless ourselves, and we can work trying to be together, and especially with the countries that need from us.
Yes, absolutely, Elena. Dr. Kribanandan, you wanted to add?
Yeah, I just wanted to say that having the awareness programs and having this contact in between the in terms of getting awareness of the SB situation and community, for us has made a huge difference, because once people know about the complexities of the condition and the amount of support which is required, I think it's been much easier for us to be able to get interventions from a whole host of people in the community. So I think the awareness is very important. Not very many people know about the conditions and how complex and complicated it is, and so I think that's been quite useful for us in terms of getting that information out, getting the connections between the families and people who can provide the support. I think that's been very very important and useful. It has made such a difference in terms of.
And I was also thinking, if one has knowledge and if one can raise their voice, how can we strengthen each other's work? And Hans Christian, what is your perspective on that from your example also when talking to different countries, and how can a platform like we're having now with the international communities, how can we support that, or how can it be of benefit for SBH?
I think that this could be have a lot of opportunities to have this kind of platform, but I think we have to have in mind that this is not going to be done in a couple of days or a couple of months or something like that. We have to have a wider perspective on this kind of matters, and we have to discuss how we can get how we together can get where we want to get in these questions, and because I can see that this cooperation that we have with Sweden and Denmark, it's very effectful to share information, but we have tried to do other things cross-border within these countries, but Sweden and Denmark, they have not enough money to do the same thing as we do. So I think that together we can do a lot of things, but we have to have the money, and we have to talk about it over a long time. And I was thinking that this is, as you said, this is the first time that this webinar has been done, and I hope that we can do like this next year on the International World Spina Bifida Day as well. But maybe then we can try to do something else to reach more people and to have more awareness of our diagnosis.
Yeah. And was there anything that one would say, Dr. Karmarkar, for example, that you say, well, in this format, we are also learning from each other?
Absolutely. So the first thing maybe we should immediately start doing is having these webinars every 3 months. Once in every 3 months, and get more and more countries and associations connected and discuss strategies for prevention, for awareness. So I think we've made a very, very good beginning on this great day. But to make our efforts more effective, we need to collaborate many more times than just once a year. Once a year is not enough. So, and now Zoom is going to make it possible. So maybe we should have every 3 months webinar where the representatives of various associations come online and we share. And maybe for those webinars, it could be on one theme. For example, say fortification. And people just talk about fortification in their part of the world. So that is, and secondly, I think as far as awareness of spina bifida is concerned, we have a lot to do. I think maybe in some countries awareness is good, but if I can talk about India, if you ask 100 people, lay people, ordinary citizens, how many are aware of spina bifida? And it's a big zero. On the other hand, talk about polio and polio eradication, and everybody, every Indian knows about polio. Polio is eradicated. Nobody has polio, but we have 40,000 or more children born with paralysis, which is worse than polio, and no Indian knows about it. So we in many parts of the world, this is probably true. Maybe in Latin America and Europe, people are better aware because of the great efforts that APEBI and LATAM has been doing since 1977. Yeah, so Elena said 1977. But we have a lot to do for awareness.
Well, I can only say that I welcome those international webinars, but that makes us still think of what can we do then on the content. So, and let me just have a cliffhanger here right now for you, and then we take it up after sharing the testimonial stories, that if we are going to continue in this digital format, in this digital way, then my question is, what are then the key priorities we need to focus on? What, to your opinion, are now 3 priorities that you think that's what we need? And I want to hold on to your thoughts because we will get back to that after the testimonial stories. So please have a thinking about it, and then we continue the panel discussion. And I trust Anna can also join us from Russia. So moving on to the testimonial stories, I'm going to invite Olufunke. While I'm sharing my screen, I will ask her to already put on her video. And then I will introduce Olufunke. Okay. Olufunke was born in 1965 with spina bifida and myelocele, studied counseling psychologist, working as an admin and HR officer with the state government, a disability advocate and Go Folic ambassador. And as she told me, she's also an entrepreneur currently running an initiative that supports and advocates for the rights and privileges of children living with disabilities. And as you can see on my screen, Olufunke is from Nigeria. Olufunke, please share your testimonial story with us.
Thank you very much, Sylvia. It's a pleasure to be in your midst this afternoon.
Olufunke, sorry, we can't see you, and your sound is a bit low. Could you find a way to speak up?
Okay, my video is on already.
Your video is black. I think you have something in front of it, and your sound is a bit poor.
Oh, video. I had some technical issues the other time, and I have to change from the system I'm using. So
the sound is a bit better, and the video is still offline.
Yes, let me see what if I can get it right. The system has some technical issues, so I couldn't connect very well.
Do you want a few minutes to sort it out? Then I'm going to move to Guatemala.
Okay. What about now?
We cannot see you.
Give me some time. You can move on. I'll get back to you.
Okay, we will see you soon. Thank you, Olufunke. Technology is always a bit challenging with these kind of webinars, so not a problem at all. We're going to move to Guatemala. And Guatemala, this is Victoria Sandoval, and it's a pleasure for me to introduce you to her. Victoria was born in Guatemala with spina bifida, and she strives for the rights of people with disabilities. But not only in Guatemala, I've also heard that she's doing that very well on an international level. So she has sent me a video, which I will show with you now. and I trust the video is okay for you to hear. If not, let me know.
Hello, my name is Victoria Sandoval. I was born in Guatemala a few decades ago with spina bifida and myelomeniingocele. What I want to express to you in this International Day of Spina Bifida is that it's important that we are defined by our goals and what we want to achieve in life. We don't have to let spina bifida to define our lives because it is simply a condition we are born with, as it is the color of our skin, of our hair, of our eyes. Clearly, it is a struggle that we have to fight every single day, but this is something that every single person in the world has to struggle with. Some people has to struggle with things that we cannot see, with conditions that we cannot see. Some other people has to do it with conditions that can be seen, as it is our case. But if we see our lives from the positive point of view, we are going to profit very much of our lives, and we are going to see all the opportunities that are presented to us every single day by the life. Have a very happy International Spina Bifida Day, and I greet to all of you. Bye.
Thank you, Victoria. And I also hope that you found a way to also attend this meeting now or at a later moment using the video. Thank you for sharing your strong words and sharing your personal testimony. It's important to hear for us, but also for other people on board. I'm going to try, Olufunke, are you now online? We can see books, but not yet you. Just let me know if you still need a few minutes, then. Yes, we can see you, but we cannot hear you as yet because you're still muted. Is with the technology these days, one can use the mobile phone and the computer and different devices. Yes, excellent that you're here. Olufunke, it's such a pleasure of having you here. Please, the floor is yours.
Thank you very much. It's my pleasure to be here, and I'm so honored to share my testimony this afternoon. Well, as you have said, I was born with spinal bifida, and I was born in 1965, and that makes me in my mid-50s now. And having spinal bifida and moving through it has not been quite easy for me. At birth, I had a surgery to close the bulging nerves in my spine, and I have a deformity on my limbs, on the hip to the nail. So there are some nerve damages to the spinal bifida, to the limbs from the hip to the lower extremities, my legs and all the rest of it. And I had some therapy growing up. I had some corrective surgery, physiotherapy, to adjust and to correct those abnormalities, which enable me to be able to walk on my legs. At my early age, like around 13 to 14 years, I developed a sore on my leg, on one of my foot, on the sole of the foot. And so it makes it very hard to move around on the leg. I had so many uh, plastic surgery done on my leg, on my foot. So as the uh, surgery is being done, after a while, after working on the leg, it breaks down again, and I have to go through another surgery to to correct it, to make the healing, the pressure sort, but it doesn't heal. It breaks down again, and so on and so forth. So in when I was around when I was getting to the age of my 20s, I was introduced to an hospital in the UK. I traveled to the UK because the facility is not available here in Nigeria to help me with my continence. So that was when I had the continence training in 1986 in the UK. I was trained how to catheterize myself, how to void the urine, and uh, be able to use the catheter to help myself to self-catheterize and remove urine. And I want to say that that actually gives me a lot of confidence to be able to be able to live on. I mean, being able to categorize myself, being able to know how to manage myself by using the catheter and voiding myself gave me a lot of confidence to move on, and also to be able to do some of the things that I was unable to do. And that was how I started the self-catheterization. In fact, when I was observed, I was told that my muscle, the bladder of my muscle is still able to hold some urine. And I was trained how to be able to void myself maybe every three hours or 4 hours, depending on how full or how my fluid intake is. And so that was how I continued to move on. And for the sore, um, then the doctor advised that I get an amputation for my leg. But uh, as confident as I seem to have a good outlook to life, I declined the amputation. Then believing that I'll be able to do manage myself very well, not without with the two legs in place. So that was how I started managing the management of the sore by taking care of it myself and being on the wheelchair so that I will not apply much pressure on the foot. And that is how I've been managing it. Sometimes it gets healed and sometimes it breaks down again. But I do not allow all this the challenges of the continence and the pressure sore to put me down, to really put me down. So I move on with my life, and I went to school. In fact, my dad then was very encouraging to me. He helped me through my school, uh, uh, giving me advice and pushing me on to do everything that I could do. So I started school, even though I started very late, but I was able to manage through school. I have lots of friends that helped me. Whatever I want to do, they are there for me. I make them to realize what I was passing through, my challenges, so that when they know what I have and what are the things that my challenges, they will be there to assist me. And I really want to thank God and thank them for being there for me, because every time I have one or two challenges, my friends understand that these are the things that I go through, and they're always there for me to assist me. And I went to school, and I went through my university days as I studied psychological counseling, and I I pressed on regardless of all the pain and the difficulties I have on the way. And one of the challenges I faced as I was growing up is the inability of the medical system to really to actually understand what it takes to be a spinal bifida and what uh, how to treat spinal bifida patient, because I believe that uh, someone with spinal bifida cannot just get a kind of treatment just like any other person that doesn't have a spinal bifida. And I take the time to actually study my system to know what I require and what my body does not require. And because I took my time to really study what spinal bifida entails, what it takes to be a person living with spinal bifida, and what my body will require and what it doesn't require, that was how I go about I go through taking care of myself. Sometimes when I discover that maybe my urine is actually somehow, I know what to do at to uh, give myself some treatment that would help me to flush out my system and get myself in order again. And so that was how I joined my foundation in Nigeria, Festus Miller Foundation. I joined the support group, and I've been active, participating in the programs by educating others, especially the young ones, on how to take care of themselves, being spinal bifida, and how they can be able to learn how to uh, help themselves with self-categorization so that they can go on with life. The way I manage myself, categorizing myself, you can hardly know that I have incontinence, because I try to keep myself clean. I try to make sure that there's nobody around me who feel that I have any issue with my bladder. And I try to train other people to tell other children and youth that are coming up how to manage themselves and go through it. I also I'm such a person that I like to interact with people and also uh, uh, become a business person, an entrepreneur. So thereby, I have a small shop where I do my business. I also work with the state government as I've been an HR officer. I go to office normally. I do my work normally. In fact, I don't see the difference between me as someone living with spinal bifida and a person that is not uh, uh, living with spinal bifida. So I think the major thing here is your outlook, your courage, the image that you have for yourself, that will help people to be able to move closer to you. And I try as much as possible not to pity myself, or I mean, not to live a kind of pitiable life whereby people will feel sorry for me. I love to live a kind of life that people will feel proud to say, oh, regardless of the physical challenge or the disability this lady has, she's still like this, she's still keeping herself clean and pure and moving on with life. And so that 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 has been it's an encouragement to me, and I wish to do more for others to live up to that, the kind of outlook that I have towards being a person living with spina bifida.
Thank you. Thank you, Olufunke. That is a powerful message, and also it shows how strong you are as a person. And I'm sure this message also inspires other people to continue the perseverance and also perceive themselves not as being different. So thank you, Olufunke, for sharing that with us.
Thank you very much.
We're going to move over to the other side of another continent again. We're going to our last testimonial speaker, and it's Sir Raj Salgado. And Sir Raipal, I said Rajas, apologies, Raipal. He's from Sri Lanka, and he will tell a story on his connection to spina bifida from South Asia all the way in Sri Lanka. And Sri Lanka is an island nation separated from India by the Polk Straits, known as the Pearl of the Indian Ocean. Well, we look forward to hear more from you.
Good day to all. It's been very interesting to hear Dr. Santosh about the figures of spine panel discussions which were making over the world for the cause of spina bifida to improve the well-being of people with spina bifida. I am here to give a testimonial from the perspective of a parent. That is, my son was born in 2003 with the condition spina bifida. As Dr. Karmarkar said, it was a totally unknown thing. I had never heard of it before. Fortunately, my brother-in-law was a doctor and he explained to me what the condition was. Yet, in Sri Lanka, we do not have a registry for spina bifida, nor do we have special clinics for spina bifida. To aggravate matters, when my son was born, his membrane ruptured on the 7th day, and he got this bacteria, Pseudomonas meningitis, which is a life-threatening disease. At the time, we transferred my son to then Apollo Hospitals, Sri Lanka, and was fortunate enough to meet up with an eminent neurosurgeon, a well-experienced neurosurgeon, and he, together with a pediatrician, managed to control the fits that my son had developed, and the surgery was done within 24 hours. If not, if we had to go to a government hospital, there would have been obviously a queue for surgery, and my son's life would have been at great danger. When someone has spina bifida, the parents have a lot of challenges. The first challenge are the surgeries. We had the closing of the spina durals, and then we had, because he had a condition of hydrocephalus, we had to have a shunt in place. That is not the end. Until today, we have had another 3 or 4 surgeries which have come along as a result of having spina bifida. He has undergone 2 detetherings, and he has also had a replacement of his VP shunt. Not only that, due to the abdominal muscles weakening, he had to have 2 inguinal hernia surgeries on both sides. So all that we have overcome. But our main challenges started when we had to start schooling. Schools in Sri Lanka, if we had to send him to a government school, would have been a it would have been almost impossible. He would have had so much of peer pressure, peer ridicule, maybe bullying, and also the facilities. For a spina bifida person, you need a clean toilet. You need a spacious toilet. So all those we were able to manage from a private international school. The condition being that he had to have a full-time attendant coming to school with him. Fortunately, as Dr. Karmarkar said, we being from a middle-class family had the resources and the knowledge. But in Sri Lanka, the majority of people are below the poverty line, basically. More than 80% are basically surviving, and they have absolutely no knowledge of spina bifida. If anybody today in this participation, if there are any Sri Lankans, please feel free to get in touch. Dr. Sylvia has my number. You can email her and get my number, because to date, I know of only one other child who has this spina bifida condition. As much as I want to form an association, get people and gather strength and give confidence, because from the experience that I have had with my son, I can obviously help those people. So I am saying, right, let's gather forces. Do not feel shy. Do not feel that this is something natural. I mean, maybe as Dr. Karmarkar said, you see there are fewer births from 10,000. I mean, at the time that I learned it, I was told 1 in 2,000. Internationally, 1 in 2,000 births have this condition, spina bifida. Most of the spina bifida children are, I think, wheelchair bound. But I am fortunate enough that my son is not wheelchair bound, but he has a deformity in one of his legs, and he has incontinence of both bowel and bladder. The bowel issue was a major concern when he started schooling, because as you know, the odors will subject him to ridicule amongst his peers. But I was so fortunate to meet up with Dr. Karmarkar. That was in the year, I think around 2011. And I went and met him in India, had discussions with him, and we did a surgery in October 2010. That is a mace and a Mitrofenov operation. The mace that one usually hears is where you have a stoma and you have a bag to collect your fecal matter. But the surgery that Dr. Karmarkar did was something which changed the life of my son, because you don't need bags, right? What he does is that the mace is from the colon, and there is a bowel wash on a daily basis, which has given virtually 99% success, where he hardly has any fecal accidents. That alone has changed his life for so much socially acceptable for him to move about and do everything that he needs. I'm telling all these spina bifida people, do what you can, because I basically, whilst my son was schooling, pushed him to go and do other extracurricular activities. He can't do physical things because of the physical condition of his leg, but he did join chess club, then he played table tennis, he joined the inventors club, and he did wonders. Major thing was that in that school, swimming was compulsory, and I had to devise ways and means for him to attend swimming classes. So I learned up, and we managed to get some anal plugs, and we managed for him to learn swimming and attend swimming classes. So my attempts at contacting the neurosurgeons and the pediatricians and the pediatric surgeons who have been in attendance with him, I have told them if there are any children who have spina bifida, please tell those parents to contact me, and I'll be glad to sort of help them, advise them, guide them from the knowledge that I have gained over the last 17 years. But unfortunately, parents believe in keeping this a closed up secret when it doesn't have to be so. I have realized with the potential that my son to date, he is interested in serving all spina bifida patients by becoming a doctor himself. Like Dr. Karmarkar said, there is no restriction. If you are treated in time, you have the knowledge, you have the intelligence to even become a neurosurgeon. So my son to date has proven, and he has got admission to go to Australia to do biomedicines. So that is a stepping stone. His ambition is to do MD one day and pass out as a doctor and serve spina bifida children, and maybe even discover new methods and technologies that can serve spina bifida children. In passing, I would like to just pose two questions for the panel discussion and the question and answer. What I want to know is folic acid the main cause and the only cause for the condition of spina bifida? Because in Sri Lanka, I'm not sure whether they have enhanced folic acid in salt. I'm not very sure whether that has been done, but that is something that we could pursue. And also, I'm very interested because mine is a son. I am very keen about his future, where you see he socio-psychologically, he would have to one day get on in life. So if you can discuss some things that, like the erectile dysfunction and erectile functions and things like that, as a child grows, a teenager, I don't think my son has a problem, but still that would be very useful. And thank you very much, Dr. Santosh, Dr. Sylvia, and all the other panelists. And my wife Sudharma and my son are all grateful and thankful to you for having given this opportunity to us. Thank you.
Thank you, Sir Raj. It was incredible to hear how you have done over the years, and also to hear your story as a parent, to deal with this important issue. Thank you for sharing your words. I will introduce now back the panel to turn on their video. So there is a large interest from the audience, and also with great questions. Looking at the time, Santosh, what do you think? Is this something for the questions to follow up with Sir Raj also hereafter, that we are just going to close down on the action together?
Yes, I think we'll just take one or two questions. The one immediate question which was asked by Mr. Salgado about, is folic acid the only cause? Well, up to 70% of neural tube defects are due to folic acid deficiency. The remaining 25-30% are due to various other causes, which may be some abnormal genetic issues and some other unknown causes which do cause folic acid, which do cause spina bifida in spite of a good intake of folic acid. So folic acid preventable spina bifida is about 70-75%. So, but even if one can prevent 75% of neural tube defects, I think it's a huge achievement. There were a couple of questions and comments, Sylvia, about aging with spina bifida and about transition care. when children become adults, what are the issues that arise, and that transition care is also something which all associations need to focus on. I think Hans mentioned about aging. In India, we are still struggling with primary care and with rehabilitation of children. So, but we will definitely, as an association, all of us, all to be looking into transition care, adolescence care, psychosexual issues, as Rajpal mentioned about sexual dysfunction, erectile dysfunction. And I want to quickly share a very interesting anecdote. I was Turkey, and a side meeting, there was a session on psychosexual care. So we were 35 people, me, one more Turkish urologist, and 33 spina bifida individuals, some on wheelchair, some not on wheelchair. And Dr. Seval Ulman asked the question, how many of you are sexually active? And in that 35, the other 33 raised their hands that they were all sexually active. So it is, possible, but we should not be hiding these things. We should be frankly and freely discussing these issues with our adolescent groups and our adult groups. With that, I think it's been a long session, and slowly the audience, as can be expected, is coming down from beyond 100 to below 100. So Sylvia, I think we should conclude, and back to you.
Thank you. And just because I warned you that we would wrap this up with 3 priorities, I don't want to miss out the opportunity for us to set the future together. So I'm just going to have a roundup for all the speakers. What are your key 3 priorities that we need to consider as an international group together, that we decide here today to move the field forward? Can I start with you, Elena? What are your 3 priorities?
Well, I think the 3 ones are communication, good communication for parents, community building. The other one, there are so many information to share, because when Santosh was just talking about sexuality, that is something that in many cities in my country and all over the world, I think that it is not talk about that, but luckily we have a group of people who are working about that to make visible that every person with this condition can have a sexual life, a very good sexual life according to the disability. And another idea I have is to be in contact by Zoom, that we can share our Zooms all over the world, and of course to try to be with translation, so people can understand every word and can share all our community, or during our conversation, they understand what we are saying. So that will be the best, to be working together. Thank you.
Thank you, Elena. Dr. Kribanandan, can I ask what are your 3 priorities? You are still muted, sorry.
I said that it was a very useful session, and I'd like to echo what Dr. Karmarkar said earlier, that maybe we should have regular sessions of this, maybe every 3 months or every 6 months or whatever it is, identifying various good practices and themes so that we can share from their experience. I think, there's such a lot of amazing experience around the world, and we can share that and hopefully develop, our own interventions based on that experience. I think that would be a very important and useful thing to do. The other thing would be, looking at collaborative environments, working with other organizations and how that can work, and maybe leveraging on some of our experiences in this context. For example, we've talked about working with Rotary, but I'm sure there are other examples where we can actually work together and take further, the interventions which we are trying to do. And the last one I would say would be awareness. I think there is, as everybody has said, when I got involved with the SB community, I had no idea about Spina Bifida, and I was just amazed that after so many years in existence, I don't know anything about it. And so I think there's a huge lack of awareness, and I think there's a good parallel. Dr. Karmarkar talked about polio and how much information and knowledge there is about polio. And yet this condition is even more serious, and we really need to get that awareness. So maybe, if we can find ways of doing that together, I think that'll be very, very nice and very good.
Thank you, absolutely. Anna, can I ask you as well about what, to your opinion, are 3 priorities for us?
Who did you ask?
Anna. No problem. Anna is still finding the button. Can I ask you, Hans Christian, to go first?
Yes, of course. First of all, I think that awareness of Spina Bifida and Hydrocephalus is very important to get awareness of these conditions out in public. And of course, fortification and prevention is also one topic that I think that is very important. And the whole lifeline, living with Spina Bifida, like transition and aging with Spina Bifida and Hydrocephalus.
Sorry, I was still muted. Thank you, Hans Christian. Anna, you are still here with us. Please, what are your 3 key priorities?
Thank you. I think we focused to work with government. It's very important now for our, and the program of prevention and the support pregnant women. And of course, it's a work working with the parents community and information program for them.
Absolutely. Thank you, Anna. And there is enough room for us to collaborate also on. With the closing words, Santosh, I know you shared already many key priorities that one needs to address. Do you want to add to the key priorities? You are muted, huh?
Yes. So I think to just summarize, there's so many things we need to do, but maybe we have to identify a few urgent, immediate things that we should be doing. And I think we have to associate firstly more with each other. So have these global webinars every quarter on some theme. Secondly, I feel associate more closely with global foundations. For example, the Melinda and Bill Gates Foundation. Associate with foundations like them tell them, probably they know about this, but they seem to be, I heard somewhere they are getting interested in fortification and neural tube defects. So if the International Federation can associate with global foundation, global health foundations, then some global programs can be facilitated. And thirdly, so 3 associations. One, associate with ourselves better, associate with global funding foundations, and third, associate with individual country governments. So maybe for this year, the Federation identifies 3 country governments to liaise with, to associate with. So I think these could be some working suggestions. And just to conclude, before you can give the final remarks, Sylvia, I just want to say this was an excellent interaction, and I've been reading some very, very good positive in the chat box, but we really had a great information sharing, the vast extent of APEBI. Then, of course, Hans spoke about his foundation and the work he's doing. Was also very exciting. Anna joining in from Russia. And Anna, you spoke great English, no difficulty understanding you at all. And of course, Dr. Kribanandan and Ruth and the other panelists, as well as excellent testimonies. And I wish to tell Mr. Salgado that hopefully by the next Spina Bifida Day, we will have an association in Sri Lanka. It's not difficult. I think we can just cooperate. And we'll take guidance from Elena's efforts in Latin America. So in Southeast Asia, we need to have a regional association like LATAM. So these are the few words that I had to say, and that's it. It's been a long, long session, and thank you very much.
Thank you, Santosh, and thank you, everybody. I'm going to share my screen just for the final slide to thank the audience as well for their patience, because I know it has been a long session, but a very fruitful one, if one asks me. And I agree with Dr. Karmarkar, with Santosh, that there's room for us to do more in the near future. So thank you for attending today's webinar. As what they always say, it's that we can all make a difference wherever we are in this world, but it's about doing it together that we can make true change. And today was just an example of hearing all the experiences and all the activities worldwide. And I hope it also inspired you for your work wherever you are in this world. So only together we can do that. And this was a first important step for us to make today. And we look forward to continue the activities on an international level, as also the energy was quite high for today. And we received lots of interest from you. So thank you all. And thank also the sponsor who made it possible for us today to have this online webinar. And thank you, Santosh, for doing this collaboratively. But most of all, thank you for the wonderful speakers, for preparing this so well and being here present and sharing your vision for the world, because we need to do it together. Thank you all, and hopefully see you soon during the next webinars.
Thank you.
Thank you.
Bye.
Thank you.
Thank you.
Bye-bye.
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 Everybody.